Daphne.
I'm Erin. Nice to meet you.
Nice to meet you too.
My name is Erin Prost. I'm the director of a medical cannabis clinic and resource center.
I'm here to maybe get some more information. I've been using medical marijuana for about 9 months now.
Well, I've been having questions regarding the use of medical cannabis. I've started using medical cannabis in 2012.
I literally have zero experience.
I don't even know where to start, so. Even just looking at this table, there's a lot of things that are a little confusing to me.
Cannabis is a plant-based medicine. So this is the flowers of the cannabis plant. And in the flowers is where most of the medicine is produced. So if you hear the terms THC and CBD,
Yes.
these are specific medicinal molecules that the cannabis plant produces. So THC often is thought to be more beneficial for neuropathic pain. CBD has a potential to affect pain. It can calm us down. It can provide an anti-anxiety effect and maybe help us to sleep. And CBD is non-intoxicating, so that's why you're finding you're still able to go
I can
to
be
school
reading,
and,
I can be like having a normal life without anything in my brain. It relaxes my muscles.
The THC, is that the thing that gets you high? Yeah.
It is the primary, we call it like the psychoactive component or
Okay.
the intoxicating component. Most people experience that as, in low doses as kind of a euphoria. They're starting to feel uplifted or stimulated in some way. And so at low doses, that euphoric effect can be therapeutic. Cannabis is a complementary treatment for the symptoms that can be associated with breast cancer. People use it to treat pain, as well as to soothe nausea and vomiting during chemotherapy, for example, as well as to improve appetite. Sometimes it can help to reduce anxiety or improve mood, and also to help with some sleep issues or to keep people asleep.
In order for me to be able to have a good night of sleep, I was taking lots of pills. When I discovered that CBD could help me to relax into a point that if with high dosage, I could just go to bed.
I started using it when I was going through Taxol chemotherapy because I had neuropathy in my hands, and I'm a musician, so that was a very scary thing for me. After even the first dose, I noticed all the neuropathy pain was gone.
So this is a vaporizer, similar to, what you would experience if you were smoking a joint, but the temperature is just at what we need to volatilize the medicinal components, and it doesn't reach the temperature of smoke. The peak effect can be reached within the first 1 to 2 minutes of one inhalation and lasts about 3 to 4 hours.
Okay, when you say inhalation, you mean like literally one inhalation or like the whole joint?
So one breath in would be what we call like a unit of taking an inhaled product. This is a body cream.
That is crazy that there's a potty cream. And it doesn't smell like pot, it smells like pine.
So this is the CBD oil that I've been using. You just take a few drops, and after that I just put it on my skin.
So an oil is the long-acting form of cannabinoids. The effects take 1 hour to 1.5 hours sometimes. Most people put it directly under their tongue, but you can
Right.
also put it into water or juice or tea.
Okay.
It does taste usually a little bit like cannabis. There'll be a bitter taste, or they can be extracted into high-fat products like oils or butters, like many people hear of
Right.
brownies.
Yes.
Or cannabis butter in some way, and that's because of the properties of the medicinal compounds. It's really an individual experience, and it's
Right.
important for a program to be customized.
I had 16 rounds of chemo, and I just didn't want to have to figure out something else. I was exhausted. I just kind of listened to my doctor, and they would prescribe me stuff for pain. It wasn't really offered to me, so I wouldn't even know where to start.
They weren't really familiar with medical cannabis other than knowing that it was available, and they were open to it. And so finally, I just called my family doctor and said, I want a referral to the cannabis clinic, and he gave it to me.
Any doctor and even some healthcare practitioners like nurse practitioners in Ontario can prescribe medical cannabis, but many of them, like you had in your experience with your family doctor, might be familiar with it, might be willing to talk about it with you, but aren't really sure where to go from there. So that's where a referral to a specialized clinic can be really impactful. Cannabis, because it's an unapproved medical treatment, is not covered by the vast majority of insurance plans. So we remember that we're still in a transition point where, relative to other medications, medical cannabis is very new. And we do have a distance to go to be able to support patients to the extent that they should be.
Do you know anything about carrying cannabis, medical cannabis, when you take a flight?
Like a special permission to travel to, like, for example, to the States?
So the medical cannabis program is Canada-wide. So you are permitted to travel with your medical cannabis, provided you've accessed it under the federal access program. So you do need to bring with you to the airport your proof of registration with the licensed producer, as well as the product in the original bottle that it came in. But medical cannabis cannot be traveled with outside of Canada.
I remember when I first got diagnosed, I had a couple of people send me a couple of articles about the curing factors of cannabis.
As someone who's gone through cancer, you know that there are many different types of cancer, and it's something that has been studied in a specific type cannot be applied across all different kinds of cancer. So it's irresponsible at this time, based on the existing evidence, to make any claims about cannabis as an anti-cancer treatment. It's a complementary treatment and should never be considered as an alternative to traditional cancer treatments.
I don't know about anybody else, but I know for myself is kind of the stigma. Cannabis is bad. Like, that's what I constantly think in my head.
I think my parents maybe were the most curious.
The prohibition of cannabis has really been really formative for so many of us, how we grew up, you know, what our parents said to us about us, what our other authorities in our lives, our teachers, our pastors, our ministers, what they've talked about. And coming out of this prohibition of cannabis, as we're just doing now in Canada, is, you know, a real shift in the society of that we're used to. Most of the side effects are related to THC, and they're generally at higher doses.
Okay.
So things like paranoia or anxiety response, increased heart rate, dry mouth, red eyes. These are common side effects, but they're generally dose dependent, and we can control the presence of those side effects and how much interference they're causing by controlling the dose.
Is it possible to get addicted?
It's approximately 8 to 9% of the population who use cannabis could develop a dependence to it. We've moved away from the idea of addiction because for cannabis, it's not a physical or physiological addiction, it's a psychological dependence. It's important to note as well that that rate of dependence is lower than it is for alcohol, and it's lower than it is for cigarettes as well.
Okay.
So we can develop safe and responsible relationships with cannabis, even those who are not seeking a medical purpose.
Well, thanks for answering my questions.
Thank you for having me.
Thank you.
My pleasure.